Well, I would just sit with them
Be
and I
present.
would just say, I'm still here. I'm here. I am here. Because being there is 100% of what you can do for someone. It's just being there with them. I
It's
think
so
that's all
true.
they need initially. And if you're a survivor, as your team is, that's what they want to see.
Yeah.
They want to see, oh, she looks okay. She seems to have a life. She went through this. And many times people say, well, did you get treatment? Yes, I did. Like, okay, well, maybe I'll do all right. And that's reassurance to them.
Yeah.
And reassurance to them that life still goes on. I mean, we have made so much progress in cancer treatment today. And I always tell young people, look, even if you look back at studies, they haven't been treated the way we treated people in the last 5 years because they haven't been alive enough to be treated. So the studies are getting better. The interventions we know are improving. So I know it's bad when you're young, but it's good when you're young because you have a lot of new treatments that we don't have today that will be available to you. So I know it's never a good time, but there's never been a better time to have to need treatment for cancer.
Yeah.
So I tell people, absolutely, it's true, and that's what they need to know. The other thing they need to know when they're talking to individuals, it's not so much, today we learn the biologics of our cancer, and so we have very different information. So you don't compare yourself to other people because there will be people who don't have exactly what you have. And so all cancers are different. They're different diseases.
Yes.
It used to be, we used to think heart disease was heart disease. But there are many paths to heart disease. It just has the same clinical symptoms. And so the same with cancer. So, stay in your lane. When you want to get information, get it from your oncologist. Accept that information and go with it because everybody else who gives you other information doesn't know your story and your disease process. Everybody else can give you information on health and give their story of what helped them, but it's always important when it comes to actually treatment that you talk to your team. I think that's really important for patients to know.